Hello everyone, welcome to Pediatrics by Dr. Anand. Is my voice visible to everyone? Is my voice audible and visible to everyone? Please put a message in the comment section. Thank you. Hello everyone, welcome to Pediatrics by Dr. Anand. In this topic, we're gonna talk about very important, nothing but what are we gonna study? We will study the continuation of our class of the what you called on the hydrocephalus. This is the second part. Hello everyone, Hanji, सब लोग आ गए? Let's start. Hello everyone, welcome to Pediatrics by Dr. Anand, and in this segment we're gonna talk about C.N.S. This is the part 5 where we're gonna talk about hydrocephalus part 2. For the new users in the Unacademy, we have this NEET PG contest which is coming on January 23rd at 11 a.m. where we're gonna ask a lot of questions from various subjects like medicine, dermatology, and anesthesia. 60 minutes, 45 questions. If you answer them well, you get just a reward from a pool of 10 lakh rupees. So if you're free, please participate. And also at the same time, hello Vedahi, hello our dear Osama, hello Saman, hello Shubhangi. And we have this, if you buy the 12 months Unacademy plan, you get 2 months complimentary. If you buy a 24 months plan, you get 4 months complimentary. And also congratulations to our toppers who have worked really hard in the exam. And now I want our students like Savan, Shubhangi, Hamid and Deepak and Vaidahi and Hamid who are working really hard, and I want their names to be there. Also, we have a free test calendar which is available on Unacademy. Please do participate if you want to get a rank 1. If you do not want to get a rank 1, don't participate. But it will be good if you participate. It will be really beneficial. In Unacademy, we have something known as Plus subscription and something known as Iconic subscription. In the Plus subscription in Unacademy, most importantly, you get to access to all my live and recorded classes. You get to study from the good educators. You get to participate in tests and quizzes, and you can watch me on your iOS laptop and Android devices. This is for the Plus subscription. If you are a iconic subscription student, then you get an Unacademy platform and also the prep ladder subscription. All the various features of prep ladder you get on the iconic subscription. So we have this month wise plan for I plus subscription and for the iconic subscription. And as an MBBS student, sometimes it becomes expensive to buy a big pack, and if you use this pack, use this code, it will be little beneficial for you, and the code is Dr. Anand. And also होली में दे देता हूँ, थोड़ी देर में देता हूँ. And also, hi Osama, and if you are an Academy user, you must be knowing we have some great features in Unacademy, like asking a poll in the form of MCQ, like asking a doubt, like you never miss my classes because all the lectures are recorded, and also we have the best of the best question bank. We have already made a batch on Focus FMG 2022 and Target NEET PG 2022 batch. We have a pathology test on 28th of January, 12:30 p.m. We have a test, and I want you guys to participate. It will be good if you participate. It will be nice. And let's start the C.N.S. part 5. The C.N.S. part 5, in this segment, we're going to talk about the continuation of the hydrocephalus topic. And at the same time, I'll be taking a test. Today, we have a surprise test. Once we finish the topic of hydrocephalus, I have some test of the general pediatrics. I have some test with you for you. Let's see if you can answer it. So it will be like a good brush of knowledge for everyone. I have I have felt that every 2 days once I teach, third day we should always have a test. So now I'll take a test of yours. और अगर जवाब नहीं दिया, देखो देखो फिर क्या होता है इसके आगे. So before starting any beautiful topic, we have this motivating quote, and today's motivating quote is: if you light a lamp for somebody, if you light a lamp for somebody, it will also brighten your path. If you light a lamp for somebody, it will also brighten your path. So most importantly, whenever you're studying, don't have this thing that I will only study from my notebook and I will not give my notebook to you, and I have a secret way of studying, and I will get rank 1, you should not get rank 1. Don't have this habit. Work hard. If you're really genuine, you will get the prize. If you're not that genuine, you have to wait. It is as simple as that. So if you light a lamp for somebody, it will also brighten your path, like the way I'm teaching you. I'm enlightening my path, like how many times I would have revised pediatrics, just imagine. And how many times you can revise pediatrics by, teaching to your friends. So teach to your friends, because if you light a lamp in someone else's brain, it will also brighten your path. Hello Steffi, hello Rachna. We were at the clinical features of hydrocephalus. Hydrocephalus, we have studied about the communicating and non-communicating, various causes of communicating and non-communicating. Now the clinical features of hydrocephalus. What was the clinical feature, Savan? What do you think? What was the clinical feature of hydrocephalus? The first thing was nothing but increasing head size. Yes or no? Macrocephaly or increasing head size. And also, it's same thing. I asked you, what is the normal head circumference of a newborn? You told me it is 33 to 35 centimeter. Then I asked you, how does the head circumference increases? You told me 0 to 3 months, 3 months to 6 months, and 6 months to 12 months. You told me head circumference increases by 2 centimeter per month in the beginning 3 months, 1 centimeter per month in next 3 months, and 0.5 centimeter in the next 6 months. Yes, yes. ओके ओसामा सेज, अगर सामने वाला हमसे छुपाए तो, अगर सामने वाला हमसे छुपाए तो उसको समझाओ कि ब्रो छुपाने से कुछ नहीं होगा। उसको सिखाओ ब्रो, जितना दोगे उससे ज़्यादा पाओगे, जितना छुपाओगे उतना कम रहेगा तुम्हारे पास, जितना दोगे उससे ज़्यादा पाओगे। ऐसी इंटेंसिटी रखोगे। देखो मुझसे, मैं इतना पढ़ा रहा हूँ, इतना पढ़ा रहा हूँ, इवन कोई रैंडम बंदा भी मुझसे पूछता है कि ये पढ़ा दो वो पढ़ा दो, आई एम टीचिंग, तो मैं तो और ज़्यादा पढ़ाता हूँ, बिकॉज माई जॉब इज़ टू टीच एंड आई वॉन्ट द मैन काइंड, द ह्यूमन टू बी, टू इम्प्रूव, वी कैन हेल्प पेशेंट्स एंड आवर होल इंडिया, द वर्ल्ड improves. I have a different vision altogether. I don't have this thing कि भाई I should only know why he is asking me question, oh will he become more brainy? No, you will have your own journey and I will have my own journey. If I am genuine, I will grow. If I am not genuine, I will practice. It is as simple as that. Next, very good, Osama Sheikh. And also, yes, increasing head size, wide open bulging anterior fontanelle, dilated scalp veins, very important. And also very beautiful, widely separated sutures. One of the delayed closure of the anterior fontanelle, one of the delayed closure of the anterior fontanelle will be hydrocephalus, right? Widely separated sutures. And also very important, dilated scalp veins are over. Yes, now this is a PG entrance question. This is a PG entrance question. Hanji, what you call, what is crackpot sign and what is McEwan sign? Crackpot sign or McEwan sign, very importantly. So once if I am having hydrocephalus, if I percuss at one part, how do you percuss? See, something known as plexor and pleximeter, like not the fingers, like this. Can you see that plexor and pleximeter? Two things we need. If I keep my finger here and 1, 2, 3, like 1, 2, 3, right? If I percuss it on my skull, ऑन द अदर हैंड आई विल हेयर अ क्रैक पॉट, घड़ा टूटने की आवाज आती है जब मैं ऐसे ऐसे परकस करता हूँ, दैट इज नोन एज क्रैक पॉट साइन. The crackpot sign produced on percussion of skull in raised ICT. If I'm having hydrocephalus, if I'm having hydrocephalus, naturally my intracranial tension would be very increasing because my CSF is so much accumulated, yes or no? So in that case, if you percuss on my skull, the other hand, basically, I will have a crackpot sign. घड़े टूटने की आवाज आएगी. That's known as crackpot sign, seen in what you called hydrocephalus. Okay, ओसामा कह रहा है मेरे दोस्त चुपके से पढ़ लेते हैं और सोने का नाटक करने लगते हैं जब हम लोग पूछते हैं तो. बहुत लोग ड्रामा करते हैं, बहुत लोग ड्रामा करते हैं. मेरी भी ऐसी एक फ्रेंड थी, मैं नाम नहीं बताऊंगा उसका, क्या पता वो मेरे को सुन रही हो. मेरी एक एमबीबीएस की बैचमेट थी, ऐसे ड्रामा करती थी वो ना खुद के पढ़ने के लिए लाइक कहती थी, चलो एनाटमी में हमारा डायसेक्शन होता था, कहती ओके ओके आई टीच यू लिवर, ओके 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 आई टीच यू किडनी, ओके ओके आई टीच यू दिस मिजेंट्री, लाइक कैडेवर में बॉडी में वो करती थी. तो हम, और वो बड़ी बड़ी तेज बोलती थी वो, दिस इज द राइट लिगामेंट, इज लेफ्ट लिगामेंट, दिस लिगामेंट टीरिस हेपाटिस, दिस दैट. And I used to tell her, dude, why don't you speak slow? Why are you speaking so fast? And then later we realized that she's revising by herself. हमें पागल बना रही थी वो. कहती मैं तुमको पढ़ा रही हूँ, मुझे पढ़ा, मेरा सर पढ़ा रही है, वो तो रिवाइज खुद से कर रही थी करके, और पागल बना रही थी वो. तो कई लोग पागल बहुत अच्छा बनाते हैं. तो वो कहते हैं ना, कहावत है, वो लड़की से पूछते हैं कि ये खाना बना लेती है, कहती नहीं पागल अच्छा बना लेती है. तो दैट कुड बी वन रीजन. पागल के अलावा कुछ और भी वर्ड था जो मैं यहाँ यूज़ नहीं कर सकता. हाँ जी. बातें बातें करा लो, आगे तो पढ़ लो, बातें होती रहेंगी. मैं अगला कमेंट पढ़ूंगा फिर बातें करेंगे, पहले तमीज़ से पढ़ लो आगे. हाँ जी. Yes, then very importantly, something known as sunset sign, a very beautiful thing known as sunset sign. And what is this sunset sign? Sunset sign is nothing but it's just due to the impingement of the dilated suprapineal recess on the brain stem tectum. Like बड़े हाई फाई वर्ड्स हैं, इनको छोड़ भी सकते हो, कोई प्रॉब्लम नहीं है. Just remember on the hydrocephalus patient in the clinical feature you will see macrocephaly, dilated scalp veins, most importantly crackpot sign और McEwan sign and sunset sign. आंखें मध्यम हो रही हैं, sunset हो रहा है, ऐसे ऐसे वो करते हैं like sunset sign. That's it, and it is due to impingement of the dilated suprapineal recess on the brainstem tectum. That's it. Next, very important, yes, what is the investigation of choice? Clinical feature खत्म हो गए. हाँ जी, जांच क्या कराया जाए बताओ. What is the, yes exactly, डूबता सूरज. What is the investigation of choice for hydrocephalus? Anyone? Okay. Okay, Shumangi says they will never teach us, they just compete. संधु says मेरे दोस्त बोलते हैं तुम तो पढ़ते रहते हो, तुम्हारा तो हो जाएगा, हमारा मुश्किल है. उनको बोलो संधु, तुम्हारे दोस्त कहते हैं ना कि तुम तो पढ़ते रहते हो, तुम्हारा तो हो जाएगा, हमारा मुश्किल है. उनको बोलो हाँ, तुम्हारा तो बहुत मुश्किल है, तुम्हारी शक्ल से भी दिख रहा है कि तुम्हारा बहुत मुश्किल है. मेरा तो हो जाएगा, हाँ मुझे पता है मेरा हो जाएगा. तुम्हारा सच में बहुत मुश्किल है, तुम कुछ करो अपना, तुम्हारी शक्ल पे लिखा है कि तुम्हारा बहुत मुश्किल है. वो बंदा तुमसे हफ्ता बात नहीं करेगा, 10 लोगों के बारे में तुम्हारी बुराई करेगा, और वो तुमसे बात करना बंद ही कर देगा और तुमसे पूछना ही बंद कर देगा कि कितनी पढ़ाई हो गई. भाई हम हैं, बाकी पानी कम है. मेरा हो या ना हो, तुम्हारा तो लग ही नहीं, हो ही नहीं सकता, तुम्हारी शक्ल पे लग रहा है करके, ऐसे लग के बोल के करके बोलना चाहिए. तुम जवाब नहीं देते ठीक से. मेरे साथ होते ना, मैं तो अच्छा खासा जवाब देता हूँ, शायद तभी मेरा कोई फ्रेंड नहीं है. दैट इज द रीजन आई डोंट हैव अ फ्रेंड. आई एम लाइक सिंगल एंड हैप्पी एंड चिलिंग आउट लाइफ, यू नो. At least I am myself, you know, and that's the best part of being myself, that I am just myself, you know. I'm not faking it, right? I'm just who I am. Love me, बड़ी प्यारी से कहा होता है ना, love me or leave me, right? I think it's very simple, right? Love me or leave me. बीच मझधार जो रहता है वो तो हमेशा ही डूबता है. Either you love me or leave me. It is so simple. You also become like this. Say love me or just leave me. That's it. Investigation of choice, very importantly, the investigation of choice is nothing but transcranial ultrasound. Transcranial ultrasound is the very important investigation of choice for our hydrocephalus. Hydrocephalus, right? Okay, can anyone tell me, like, okay, fine, fine. That much only I'll ask you. What is the investigation of choice for HIE? What is the investigation of choice for HIE? What is HIE? Have you heard of HIE? Hypoxic ischemic encephalopathy, yes or no? See, we have to study, we have to finish C.N.S together, okay? We have made this very small batch of 20 students, and I want that we should finish C.N.S from A to Z. So we'll finish the 1000 MCQs of C.N.S like this. The investigation of choice for HIE will be our MRI. MRI imaging will be our investigation of choice for HIE. बच्चा पैदा होके नहीं रोया है, दिमाग में ऑक्सीजन की कमी हो गई है, इसका MRI कराते हैं. The baby has not cried immediately after birth. Some oxygen problem has happened in the brain. Let's get an MRI done. What is the investigation of choice for neonatal seizure? Anyone? What is the investigation of choice for neonatal seizure? A newborn baby is having seizure. What is the investigation of choice? Very good. Yes, Savan, Shubhangi, Osama, Priya, Sandhu. Pancake, pancake आ गई आज. Hey pancake, what's up? हाँ. Okay. Anyone? Sandhu? नहीं. MRI is not investigation of choice for neonatal seizure. MRI नहीं. Not MRI. Okay, that's a homework. MRI नहीं है, मुझे इतना पता है. हाँ जी. The investigation of choice for newborn having seizure will be a very important exam question. It's a homework for you. Let's see if you can answer. Tomorrow I'll ask you again. Okay, remember now the transcranial ultrasound is the investigation of choice for our what? For our hydrocephalus. Can we see? It's a very beautiful picture. Can we see that? This one. What is this? This is our anterior fontanelle. Yes or no? This is our anterior fontanelle. नहीं ना जी, EG भी नहीं है, MRI भी नहीं है, जो करना कर लो, नहीं है EG. हाँ जी, अच्छा सारे एक EG, सारे EG. बारात में आए हो, बारात. सब अगर 501 डाल रहे हैं, सब 501 ही डालेंगे, 1000 का नोट कोई नहीं डालने वाला है ना, 1000 के नोट तो बंद हो गए हैं. हाँ जी. सो ओके, लेट्स मूव फर्दर. Yes, and the surgical treatment of choice. The surgical treatment, it's another exam question. The surgical treatment of choice for nothing but hydrocephalus is nothing but VP shunt. What is VP shunt? VP shunt is ventriculoperitoneal shunt. Ventriculoperitoneal shunt. Okay, VP shunt means you will put one pipe in my ventricle, and then coming like that, you will put one pipe in my peritoneum. So ventriculo peritoneal shunt you will do. So much of CSF is there, no? Yes, exactly. हाँ जी, very true. Yes, transcranial ultrasound is the right answer. हाँ जी, so ventriculoperitoneal shunt जो है, that will be a treatment of choice for hydrocephalus. Surgically treatment of choice for hydrocephalus is VP shunt, ventriculoperitoneal shunt. That you should know. Okay. Yeah, this is another exam question, another MCQ for exam. Which is the most common cause of meningitis as a complication of VP shunt? Like the patient they was having hydrocephalus, मैंने उसको ventriculo peritoneal shunt डाला, वो shunt डाल के patient को आगे as a complication meningitis हो गया, right? Because he's anyhow he's having raised ICT, right? He's having raised intracranial tension, yes or no? So which is the most common cause of meningitis as the complication of VP shunt? Yes, very importantly, Staphylococcus epidermidis. Staphylococcus epidermidis is a very important PG question. Very important question. Okay, means I am having hydrocephalus. You put a VP shunt, and as a complication later, I developed meningitis also because of that shunt. And so, what is the most commonest organism? The organism or the cause is Staphylococcus epidermidis. Staphylococcus epidermidis. That you should know. Okay, yes, exactly. And also, you know that, right? I am having hydrocephalus. I am having hydrocephalus, right? I am having CSF accumulation. I am having raised intracranial tension, or you can say raised intracranial pressure, right? Raised intracranial pressure. No. So, what is the management? Anyone? What is the management for raised ICT? Any random guesses? What do you think? What is the management for this one? I just don't like such people. Yes. Okay. So management, कैसे मेरा raise ICT, कैसे मेरा hypertension आप कम करोगे? Anyone? Most importantly, point number one, head and elevation. Basic. Yes, very true. Before acetazolamide, Diamox की tablet आती है. Diamox is nothing but acetazolamide. So number one, very importantly, head and elevation. Head and you'll do a prop up to my position. You'll keep to my head of 45 degree. Number one, head and elevation. Very importantly, controlled hyperventilation. See, I am having raised ICT. I am having raised intracranial tension. Okay, raised ICT I have. Okay. So number one, you put a head and elevation, controlled hyperventilation, and mannitol. Very important. Mannitol is a very good drug to decrease the intracranial tension or decrease the intracranial pressure. So at least heading and subheadings you should know. How will you manage raised ICT? Head and elevation. Mannitol, very importantly, mannitol is nothing but diuretics. Yes or no? Mannitol is an osmotic diuretics. Whatever that pressure which is high, I'll pass urine, lot of urine. So my pressure will relieve down. So raised intracranial tension, you will give me mannitol. You will give me mannitol. And also, of course, if you give me so much of diuretics, it will decrease the viscosity in the brain. My blood, no, because of raised intracranial tension has become very viscous, has become very thick. To decrease the viscosity in the brain, basically, you'll give me mannitol. So number one, head and elevation is important. Number two, mannitol is important. At least two things. Yeah. Sandhu, can you please share the PDF in the group after the class? Sandhu, I don't share the PDF, dear. मैं PDF share नहीं करता. Last year I shared the PDF last year. Students starting selling this PDF in 100 rupees everywhere in Delhi and all the classes. And people were calling and like, why have you shared your PDF? लोग 100 रुपए में बेच रहे हैं उसको. So I don't like that. So that's why I don't share the PDF. I'm so sorry. Take a screenshot, write on your notebook, make notes. That's all I can say. So the management of raised ICT, number one, head and elevation. Mannitol is very important. And also, of course, when you give me so much diuretics you're giving me, which is decreasing the viscosity in my brain, and it improves the cerebral perfusion. Cerebral perfusion. Actually, लोग सच में बेचते हैं. मतलब भारत में पैसे की इतनी कमी है. In India, people are lacking so much of money. People are selling. I can't name the student who did that last year. He sold my this one, my notes. He made a PDF. He made a notebook of that. Dr. Anand notes. Dr. Anand notes. Dr. Anand notes. Dr. Anand only doesn't know that he is selling notes. Dr. Anand doesn't know he's selling notes. And people are telling Dr. Anand knows Dr. Anand's notes. तो इतना भी ड्रामा होता है इसलिए अब let's avoid that. So that's what head and elevation, mannitol very important, or because the diuretics, it will decrease the viscosity in the brain, it will helps my cerebral perfusion, very important. And that's what. And in some cases 3% saline, 3% saline, or I can say hypertonic saline, that also helps in relieving the raised ICT. Yeah, this is business, that's very true. So 3% saline also is important. It is headings you should know. What heading I should know? Head and elevation, mannitol, 3% saline, 3 तो पक्का पता होने चाहिए, ठीक है। नेक्स्ट sedatives, naturally I if I'm getting a raised ICT, I might throw a seizure, yes or no, I might throw a seizure if I'm having raised ICT, yes or no। तो diuretics तो हो गया ना डियर, diuretics तो हो गया, mannitol हो गया, osmotic diuretics। तो नंबर 1 head and elevation, नंबर 2 diuretics, नंबर 3 3% saline, नंबर 4 sedatives, give me sedative like benzodiazepines or barbiturates because I might throw a seizure बिकॉज ऑफ रेज आईसीटी, है ना। हाँ जी, यस, पैनकेक थेरेपेटिक सीएसएफ ड्रेनेज भी होता है, बट अगेन कॉमन थिंग्स आर कॉमन एंड रेयर थिंग्स आर रेयर, वो बिल्कुल आगे जाके होता है, जो मैंने कभी करा भी नहीं, लेकिन थोड़ा लेट होता है। एंड वेरी इंपॉर्टेंटली सेकेंड लाइन ड्रग मोस्ट इंपॉर्टेंटली कम्स इज decompressive craniectomy। Anyone who wants to be a surgeon, like in Grey's Anatomy, so that's one. So you can do a decompressive craniectomy to relieve our intracranial tension and also induce coma. I am having raised ICT, I might throw a seizure. So to prevent that, you will do a decompressive craniectomy. You will do give me an induced coma, okay, and then even induced hypothermia also. Why, sir? Why hypothermia? I will give to the patient, and patient to see IS intracranial tension will resolve, because basically hypothermia, no, it decreases the metabolic activity to the brain. Very important. Hypothermia, it, yes, exactly, pancake is right, induce hypothermia also, yeah, it reduces the metabolic activity of the brain. Very good. Okay, Sandhu says, क्या डॉक्टर्स के ड्रामा डॉक्टर्स देखो सर ऑन Netflix, what is the name? I don't know, I tell me the name again. So yeah, that's what, so induce hypothermia. So I'll repeat again, this is the second line. When someone asks you what is the management of raised ICT, don't directly say decompressive craniectomy. In your next exam, in your next PG exam, by mistake किसी ने ज़बान पहले खोल दी, sir I would like to do a decompressive craniectomy, and the examiner will be like, very good. See you after 6 months. You are a Shahenshah. See you after 6 months. Go home. So that's what. Because first line treatment will be our, very importantly, head end elevation, mannitol, 3% saline, most importantly, and then again our sedatives. This is the first line. Second line, you will have decompressive craniectomy, induced coma, induced hypothermia, those things you will have, okay. And yes, as our Sandhu's pancake says, therapeutic CSF drainage. So much CSF has accumulated in my body. I am having hydrocephalus, I am having raised intracranial tension. So most importantly, yes, what you called कहते हैं therapeutic CSF drainage. मैं नहा के आया हूँ, मेरे बाल अभी गीले हैं. So therapeutic CSF drainage done. That's what. Acha, what is this one? Again, this has already been a NEET PG question. So what is this? Any random guesses? What do you call this? What is this? Any random guesses? Which entity is this? Is this hydrocephalus? What is it? मैंने तो कभी देखा ही नहीं पहले. क्या है ये? Any random guesses? What is it? Is this hydrocephalus? Is it something else? So we have done this. Ibza says hydrocephalus. Remember, it's hydranencephaly. Hydranencephaly. पानी मॉर्निंग कल क्या है? मंडे, हाँ कल मॉर्निंग. हाइड्रोनेंसिफली, स्पेलिंग मुझे याद नहीं है. सो या ये रहा हाइड्रोनेंसिफली. हाइड्रोनेंसिफली मीन्स वाटर, ओके, मीन्स वाटर. सो hydranencephaly is nothing but water. So yeah, exactly. Okay, one second. Yes, exactly. So one second, Pooja. Pooja, I'll tell you. I will ask. Tell your, not tell. I will answer your doubt in 2 minutes. This is hydranencephaly, very important. So in hydranencephaly, we need to remember, most importantly in hydranencephaly, what you should know, like cerebral hemisphere are absent. The cerebral hemisphere is absent and the remaining cranial cavity is filled with cerebrospinal fluid. It is just the cerebrospinal fluid, nothing else there in the brain. There is no cerebral cortex, there is no corpus callosum, there is no ventricles, only complete clear-cut cerebrospinal fluid. So this full water is nothing but hydranencephaly, okay. And also this is hydrocephalus. This is a good picture. See this one. Can we see that this is our cerebral hemispheres? This is our, what you called, fourth ventricle. Here it was third ventricle. This is our cerebral subarachnoid space. So this is a normal picture, and this is nothing but hydrocephalus. This is hydrocephalus, and this is hydranencephaly. So hydrocephalus, hydranencephaly, hydrocephalus, hydranencephaly. That's what. So now that comes to a very importantly, yes. This is a recent question, 2016. Following features differentiate Hydranencephaly from hydrocephalus. So please read what you called, and let's see how you're gonna start. Okay. Okay, Ibza says, sir, after CNS, which topic you are going to start? Ibza, we have covered many topics actually. The whole neonatology we have covered, the syndromes we have covered, growth and development we have already covered. Then milestones, very importantly, we have covered. Vaccines we have covered already. Then whole cardiology, whole CVS we have covered, and now we are covering full CNS. I'm planning to start. Maybe I'll start infectious disease or I will start respiratory system. So what everyone says, I will start maybe a RS respiratory or I'll start a infectious disease. Infectious disease, measles, mumps, rubella and all those things. Okay, हाँ जी. अच्छा डी, एक तरह देखो. अच्छा एक ने डी बोला तो सबने डी बोल दिया. ओके देखते हैं. अच्छा जरा इधर आ जाओ तुम. किसने डी बोला? सारे के सारे आ जाओ इधर. Following features differentiate hydranencephaly from hydrocephalus. Hydranencephaly is static while hydrocephalus continue to increase in size. On which planet I told you that hydranencephaly is static? किस एंगल से ये static लग रहा है? ये कहाँ से static है my dear? This is not static at all. It is not static. ये पहले सर छोटा था, फिर बड़ा, फिर बड़ा, फिर बड़ा. It grows in size. It grows in size. Okay. So it is not static. Hydranencephaly is not static, first of all. So this question is wrong. Acha, hydranencephaly does not cause increase in head size. This also is wrong, na? Hydranencephaly does not cause increase in head size. इतना बड़ा सर नजर आ रहा है किसी को? अंधे हो तुम लोग? देखो देखो है, इतना बड़ा सर है. ये डज नॉट कॉज इंक्रीज इन हेड साइज. ये क्या जादू का सर है या ऋतिक रोशन का सर है ये? हाइड्रोनेंसेफेली डेफिनेटली कॉजेज इंक्रीज इन हेड साइज. इतना बड़ा सर नजर आ रहा है, कहाँ कह रहे हो कि नहीं 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 जी सर तो कहाँ ही बड़ा है, ये तो वैसे ही मजाक चल रहा है. नहीं, ऐसा कुछ नहीं है, सर बहुत बड़ा हो जाता है. एंड ऑप्शन नंबर सी इज द बेस्ट आंसर. Option number C says that cerebral cortex is deficient or hypoplastic in a case of hydranencephaly. That's what it differentiates from hydrocephalus. Now, in hydrocephalus, cerebral cortex is not deficient and cerebral cortex is not hypoplastic. Whereas, what you called in hydranencephaly, cerebral cortex is deficient and it is hypoplastic. और खुद सोचो ना, ऑप्शन नंबर बी लिखा है hydranencephaly does not cause increase in size. लो जी, it does not cause macrocephaly. भैया ये देखो ना, इतना बड़ा सर है डियर, इतना बड़ा. कहाँ से कौन कौन किस किस समझदार ने कहा है कि ये बड़ा सर नहीं है? किस समझदार ने बोला है कि ये मैक्रो की फैली नहीं है? किस समझदार ने कहा है कि ना जी ना, साइज तो बढ़ता ही नहीं सर का. सर का साइज तो बिल्कुल सावन के सर की तरह छोटू सा रहता है. सो आई समझ के नहीं आई. हाँ जी, गुड. यू बेटर टेल द राइट आंसर, अदरवाइज यू आर डेड. Jipmer 2017. A baby is born with fused eyes, single nasal chamber, and underdeveloped callosum. What is the diagnosis? हाँ जी. ठीक है, हाँ जी, बताओ 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 बताओ. यस यस यस. Yeah, so it's nothing but holoprosencephaly. Very true. It's a very, इस 25 बार ये क्वेश्चन हम कर चुके हैं, 26वीं बार कर रहे हैं मेरे ख्याल से. So 26th time we are doing this question. A baby with no nasal chamber, or you can say single nasal chamber with fused eyes. So typically it's a case of holoprosencephaly. Next, which is the most commonest cause of ventriculomegaly in a newborn? Recent question 2017. So A, B, C, D. Which is the most commonest cause of ventriculomegaly? वेंट्रिकल्स किस वजह से हाँ. संधू से, अच्छा संधू, अच्छा संधू से, ये तो जिंदगी में नहीं भूलूंगा. बिल्कुल नहीं भूलना भाई, बिल्कुल नहीं भूलना. Exactly. Savan is right. Holoprosencephaly is because of when the right, like what you called, failure of the forebrain to divide into two cerebral hemisphere. Failure of the forebrain to divide into two cerebral hemisphere leads to an entity known as holoprosencephaly. In this question, yes, the most commonest cause of the most commonest cause of ventriculomegaly in a newborn is nothing but aqueductal canal of Sylvius stenosis. Next question. Okay, this is over. हाँ. Which of the following is not a cause of communicating hydrocephalus? Recent question 2012. अब ये भगवान जाने, अब देखते हैं कौन बताएगा. Which of the following is not a cause of communicating? अब देखते हैं, दिमाग के घोड़े दौड़ाओ, ठीक है। व्हेन विल यू टीच एंडोक्राइनोलॉजी? बट अगेन बिफोर एंडोक्राइनोलॉजी डियर, आई थिंक आई शुड टीच रेस्पिरेटरी सिस्टम और डायरिया, डिहाइड्रेशन, गैस्ट्रो और मस्कुलोस्केलेटल सिस्टम लाइक ड्यूशने मस्कुलर डिस्ट्रोफी, टीईएफ एंड ऑल दैट, और अ बिग रेस्पिरेटरी सिस्टम जिसमें इतने सारे क्वेश्चंस आते हैं, कंजेनिटल डायफ्रागमेटिक हर्निया, निमोनिया, एस्थमा, ब्रोंकियोलाइटिस, आरएसवी, एपिग्लोटाइटिस, क्रूप एपिग्लोटाइटिस, इतना कुछ आता है उसमें। हाँ जी, द बेस्ट आंसर फॉर दिस क्वेश्चन इज एग्जैक्टली, हु टोल्ड द राइट आंसर? थैंक गॉड। अच्छा, ओहो, सबको आता है, क्या बात है, सही है। गलत आंसर किसने दिया? गलत, जिसने गलत दिया उसने डिलीट कर दिया। ओके, क्यूट, नाइस। Pancake, what is VOGM? Vein of Galen malformation. Vein of Galen malformation. Okay, done. Investigation of choice of hydrocephalus in an infant. ऐसे ऐसे क्वेश्चंस आते हैं, तो बेइज्जती ना कराना अपनी, अब प्यारे प्यारे आंसर्स देना। इन्वेस्टिगेशन ऑफ चॉइस फॉर हाइड्रोसिफेलस, what is VOGM? अच्छा, last class you have not entered, no? In the last class you have not taken what you call pancake. That's why you're asking what is VOGM. Vein of Galen malformation. Cranial ultrasound is the investigation of choice for hydrocephalus. Cranial ultrasound, what you called? Okay. What you called cranial ultrasound is the investigation of choice of what you called hydrocephalus. Cranial ultrasound. Most common cause of fetal ventriculomegaly is DNB pattern 2013. Again a simple question. Most, ये तो पहले मैं ही बता देता हूँ, हाँ जी। Very true. The most common cause of fetal ventriculomegaly is nothing but same again, aqueductal stenosis. C is the best answer. We know that we have the lateral ventricle, third ventricle and fourth ventricle. We all know this already. Okay. One second. Okay. This is the good one. This is the again a good one. Arnold Chiari malformation. In the last to last class, we have already studied the neural tube defects. Arnold Chiari malformation is characterized by all except. अब ये बता दो तो मजा आ जावे. What do you think, everyone? हाँ जी. ABCD. Arnold Chiari malformation is characterized by all except. ABCD. ये कौन सा C लिख रहे हो? D C ABC ABD what? Okay, IBSA. Okay, Arnold Chiari malformation is characterized by all except. Exactly. Savan is right. Shubhangi is right. Sandhu is right. So why do you remember, dear? Okay. So okay. First of all, very good. You all are answering very well. I'm very happy that everyone is participating. अपनी बेइज्जती करवाइए, प्लीज अपनी बेइज्जती कराइए, जितना ज़्यादा हो सके पार्टिसिपेट कीजिए, पार्टिसिपेट एज मच एज पॉसिबल, बिकॉज मिस्टेक्स आर अ प्रूफ that you are trying, and these mistakes if you do in exam you have to wait for 6 months, but these mistake if you do today you can save your 6 months. So number one, in Arnold Chiari, what happens? Number one, Arnold Chiari malformation is nothing but is divided into type 1 and type 2. Type 2 is the classical form, right? Classical form. If there is downward displacement of the cerebellum or cerebellar tonsil only, that is type 1 Chiari malformation. And if there is a downward displacement of the cerebellum plus the brainstem in the foramen magnum, that is known as type 2 Arnold Chiari malformation. Yes or no? याद है नहीं याद है? We have done it very beautifully. If you are a newcomer, please watch our senior C.N.S videos previously. So is there a herniation of cerebellum? Hanji, yes, there is a herniation of cerebellum. Adulthood syndrome is not associated with hydrocephalus. Yes, it is not associated with hydrocephalus. And flattened base of skull, yes, you can get it. But hypoplasia of the cerebellar vermis. So this is the answer. You do not, I told you multiple times, there is no, you do not see the hypoplasia, or I would say hypoplasia. Yes, you do not see. Yes, okay. Pancake says, I think you have taught these topics previously. Of course, we have taught this topic previously. Full 1 hour classes we have taken Pancake, and some classes you were there also. Exactly. So that's what. So remember, in Arnold Chiari malformation, there is downward displacement of either cerebellum or cerebellum plus the brainstem in the foramen magnum, but there is no hypoplasia. That's what the point, so the A is the best answer. And in Dandy Walker malformation, there is hypoplasia of cerebellum, whereas in Arnold Chiari, there is no hypoplasia, there is only herniation of the cerebellum. इतना अपने माथे पे लिख लें तो बहुत भला होगा, बहुत भला होगा. ठीक है, that's over. Okay, let's see now. If you recent question 2013, common deformity in the carry one malformation. Common deformity in the carry one malformation. Is carry one malformation related to syringomyelia, meningomyelocele, hydrocephalus, or all of the above? What do you think? So this is a revision class, okay? So it's like you need to know it. You have to answer. Type 1 Arnold carry. Very good. People who are beautifully answering are Osama, Sandhu, Rachna, Umesh. ठीक है? So very good. Type 1 is associated with Syringomyelia, whereas type 2 is associated with Hydrocephalus. Yes or no? Do you remember, my dear friends? We have done this. हाँ जी, पढ़ रखा है ना हमने सारा का सारा ये. इफ़ यू आर अ न्यू कमर प्लीज़ वॉच द प्रीवियस वीडियोज़, वरना ऐसे नहीं होएगा. ठीक है, हाँ जी. सो टाइप 1 इज एसो टाइप 1 आर्नोल्ड कैरी मालफॉर्मेशन वेयर देयर इज ओनली डाउनवर्ड डिस्प्लेसमेंट ऑफ cerebellum or cerebellar vermis. So if there you will see syringomyelia, okay, and what is syringomyelia? This one, this kind of a cystic cavity, this one, ये छोटे छोटे जो cyst हैं ये arrow में, this is nothing but kind of a cyst things. Yeah, exactly. Very good, Savan, very good. Done. Finish. Okay. Huh. Okay, let's see. Okay. About Dandy Walker malformation. Recent question 2013. Okay, how long is the class? Till 9:30 we have the class, dear. Because once we finish this C.N.S. wala MCQs, then I have made another 50 MCQs of general growth and development. General image-based revision I have done. I have made some MCQs. So I want you guys to revise the previous full neonatology and growth and development also. Anji, what is the answer for this? Yes. Yes, Hamid says beautifully. We have read this. Yes, my dear boy. Yes, about Dandy Walker. Dandy Walker. Can they, about Dandy Walker, what is true? Can they have hydrocephalus? Hanji sir, 80 to 90% patient can have hydrocephalus. Is there an expansion of the fourth ventricle? Definitely. There is cerebellar hypoplasia? Definitely. So all are true? Definitely. So all of the above is the best answer. Okay, very good. Done, very true. Okay, congenital hydrocephalus, recent question 2012. So, congenital hydrocephalus, what is the treatment of choice? VP shunt, acetazolamide, glycerin, or furosemide? Very, very easy question. Even this, my grandmother also can answer this question. So, congenital hydrocephalus, the drug of the treatment of choice, the treatment we see, all are treatment, okay, all are the treatments. We give Dimox, we give glycerin, we'll give osmotic diuretics, but VP shunt, ventriculoperitoneal shunt, is our best answer. Exactly. Sandhu says मोती की तरह पढ़ाया है सर ने ये लास्ट क्लास में. Very true. बिल्कुल सही जवाब दिया है आपने. Okay, now this part is over. Let's do the general MCQs. I want to ask you 50 MCQs from general pediatrics. Okay, let me just okay. अब तो ऑप्शन भी नहीं देने मैंने. इन क्वेश्चंस की सबसे अच्छी बात मुझे ये लगती है कि मुझे ऑप्शन देना पसंद ही नहीं है. जब बिना ऑप्शन के कर पाएंगे तो जिंदगी में सब जीत पाएंगे. वेयर डू यू सी दिस साइन? पहले तो भैया ये है क्या? ये सावन की फोटो है या संधू के बचपन की फोटो है? किसकी फोटो है ये? हाँ जी, सावन सिंह. वेंट्रिकुलर पेरिटोनियल शंट इज द डेफिनेटिव सर्जिकल मैनेजमेंट ऑफ चॉइस, और वीपी शंट इज द ट्रीटमेंट ऑफ चॉइस फॉर हाइड्रोसेफेलस. व्हाट इज दिस एग्जैक्टली? Exactly. Pancake, yes, my dear. Caterpillar, exactly. Where do you see caterpillar sign? Where do you see caterpillar sign? Anyone? पहले एक guess मारिए और उसके बाद I'll show you the MCQ. I'll show you the options. Exactly. चलो pancake पढ़ के आइए. Caterpillar sign. The options are, where do you see caterpillar sign? A, B, C, D. Hmm. Yes. ऑन शूज. ये ऑन के शूज हैं. हाँ, हो सकता है. सो कैटरपिलर साइन, यस माय डियर, इट इज सीन इन कंजेनाइटल हाइपरट्रोफिक पाइलोरिक स्टेनोसिस. And what is the treatment of choice for CHPS? What is the name of the surgery for CHPS? Any idea? The name of the surgery, I think we all know that. We have done that. It's nothing but Ramstedt pyloromyotomy. Pyloromyotomy. Okay, Ramstedt pyloromyotomy is the surgical management of choice for congenital hypertrophic pyloric stenosis. है ना? Caterpillar shoes. Very true. Very true. Pancake is right. Next question. Okay, which of the following X-ray should be advised for bone age determination between 14 year of age? 14 year, 14 साल का बच्चा है तो उसको बोन एज एस्टिमेशन करना है. अब आप कौन सा उसको वो कराएंगे, विच एक्सरे वुड यू लाइक टू एडवाइज फॉर अ बोन एज एस्टिमेशन फॉर अ 14-year-old child? उमेश, पूजा, okay, pancake says wrist. So proud of you, pancake, so proud of you, so proud of you. But luckily wrist is not the right answer. जो बच्चे pancake को कॉपी कर रहे हैं, भला हो तुम्हारा। मैं कौन सी संस्कृत में प्यार वाली बातें करूं, क्या कहते हैं, हाँ जी। सो एनीवन, कितने 14 साल पे हम डॉक्टर सावन, 14 साल के बच्चे में तुम भैया रिस्ट का एक्सरे करोगे? एनीवन? तो कैसे डिवाइड करते हैं? कैन एनीवन टेल मी? For newborn baby, for bone age estimation, you do X-ray knee joint. For roughly 3 months to 12 months, we do X-ray shoulder. For 1 to 12 year, we do X-ray wrist. क्या बच गया फिर? क्या बच गया? मेरा सर बचा, क्या बचा? So after 12 years or 12 to 14 years, which is the best X-ray you wanna get it done? Anyone? Question number 91. So question number 91, you'll get a X-ray elbow joint. तो एक्सरे एल्बो जॉइंट इज आर बेस्ट आंसर। एक्सरे एल्बो, 1 से 12 साल के बच्चे में कलाई का एक्सरे कराते हैं, उसके बाद या तो हिप का एक्सरे कराते हैं या फिर यस, ओके, इट वाज yo, okay, yes, it was more than 12, yes, pancake, yes, okay, so yes, so I think that's what elbow or hip is the best answer. Okay, done. Question number 90. Question number 90 is what's my age? So what is my age? Question number 90. Osama, Pancake, Savan, Basant, Pooja. What is my age? The options are 6 to 7 months. Then we have what you call 7 to 9 months, 9 to 12 months, and more than 12 months. What is my age? What is my age? Exactly, exactly. The first temporary teeth to appear in a baby is nothing but lower central incisor, which comes by 6 to 7 months. So the best answer for this question is nothing but 6 to 7 months. खरगोश के दांत, yes, very true. Yes, yes, yes. Pooja, Umesh, Osama, Hemal, very good. Next question. Okay, this, so I think everyone knows. Again, I'll not give option for this. What is the answer for this question? What is this? Options की I think जरूरत ही नहीं है. What do you call for this? ये तो बचपन से तुम तो सारी उम्र तुम्हें याद रहेगा. So this is nothing but, I think we all know that this is nothing but what is called holoprosencephaly. Holoprosencephaly. Okay, very good. Next question. Yeah, this is question number 88 is a good one, which we have not done before. The earliest SMR staging by which sperms can be found in the urine of a boy is what? Earliest SMR staging. SMR is sexual maturity rating staging. Earliest SMR staging by which sperms can be found in the urine of a boy is which stage? You know, right? We have a SMR staging. We have the Tanner staging. अच्छा, मुझे पूछना चाहिए था वैसे तो. Tanner's staging we have for the sexual maturity rating for boys and girls. So which stage basically? Yes, exactly. I think yes. So only Steffi and our Osama is right with Shubhangi and Hamid. Stage 3. So stage 3. In the stage 3 of SMR, you will see sperms can be found in the urine of a boy. Sperms can be found in the urine of a boy. Very good, Savan. Very good, Hamid, Shubhangi. Awesome. Okay, very good. So stage 3. Question number, what you called? Question भी बड़े बड़े है ना. Question number 87. What is the formula? What is the formula of a number of permanent teeth between 6 to 11 years? This is a good one. मैं मान जाऊँ, अगर बता दे मुझे 6 साल से 11 साल के बच्चों में कितने दांत होने चाहिए, उसका एक फॉर्मूला होता है. From 6 year to 11 year, to know how much permanent teeth a baby should get, there's a formula. So what is this formula? The options are age in years minus 2 multiply by 4. बताओ A B C D. What is the best answer? Pancake, Ibza. Ibza is very good. Ibza, maximum Ibza is answering wrong, but still she's answering. She's answering. It's good. It's good to answer. I like your confidence. And Steffi says B. Question number 87. So question number 87, the best answer for question number 87 is this one. So please write age in years minus 5 multiply by 4. Age in years minus 5 multiply by 4. That is the formula to for 6 साल से 11 साल के बच्चों में कितने परमानेंट टीथ होते हैं निकालने का फॉर्मूला. ठीक है. यस, ये 210 क्या है? एनी आइडिया उमेश? हाँ जी, डी आई गेस. हाँ जी, डॉक्टर सावन सर, बिल्कुल डी सर. बढ़िया जवाब दिया सर आपने. आपको मिलते हैं बहुत सारे चॉकलेट्स, बहुत सारे गोलगप्पे और बहुत सारे छोले भटूरे. Very good. Next question. Next question. Question number. What is this? Yeah, this is a good one. Again, I'll not show you options. I don't feel like showing you option. Okay, हाँ जी बताओ क्या है ये? Today this patient had come to in my hospital. Okay, Ibza says, sir, I answered above two correct only. Okay, Ibza, that's very good. So proud of you. Very good. Anji, I don't feel like showing the options. Okay, Pancake says biryani. This looks like a biryani to you. Okay, what? Elfin faces, नहीं elfin तो थोड़ा elfin face अगर होता मैं front चेहरा दिखाता. Elfin faces, if I have to make an MCQ, I would have shown you the front face, not the lateral face. Lateral face, what can you see? See, low set ears, chalo, anyone can tell. Low set ears, anyone can tell. वेरी गुड वेरी गुड वेरी गुड वेरी गुड क्या बोलते हैं उसको हेमाल हैज टोल्ड द राइट आंसर सो द ऑप्शंस आर टर्नर सिंड्रोम Beckwith Weidman syndrome, Smith Lemli-Opitz syndrome, and Pierre-Robin syndrome. So after these options, like what is the best option? Anyone? Exactly. The answer is Pierre-Robin syndrome. Pierre-Robin syndrome. The point will be micrognathia. Most importantly, glossoptosis, which is nothing but downward and backward displacement of tongue. Glossoptosis, U-shaped cleft palate, U-shaped cleft palate, difficult bag and mass ventilation, difficult bag and mass ventilation, and roughly ASD also in these cases we can see. So all these are points of Pierre-Robin syndrome. Okay, difficult bag and mass ventilation, micrognathia, glossoptosis, U-shaped cleft palate, and that's what you need to know. And one of the causes of natal teeth. Yes or no? Do you remember? What are the other causes of natal teeth? Who will tell me? What are the other causes of natal teeth? एक कोई एक बता दो गलती से. Anyone by mistake? What are the other causes of natal teeth? Anyone? What are the other causes of natal teeth? कोई याद है कोई निमोनिक गलती से किसी ने भगवान किसी ने पढ़ाया हो सपनों में रात को आके हैं अच्छा सोटोज yeah that's right very good so the cause of natal teeth are the mnemonic is P's. P for this only, Pierre-Robin syndrome. Okay. E for Ellis Van Creveld syndrome. Ellis Van Creveld syndrome. Another is epidermolysis bullosa. Epidermolysis bullosa. And S for Soto's syndrome. Soto's syndrome. Okay, yes, do you remember this? So these are the four important causes of natal teeth. Causes of natal teeth. Okay, Pierre Robin syndrome, Ellis Van Creveld syndrome, epidermolysis bullosa, and Soto's syndrome. Okay, done. Next. Okay, what is this syndrome? This one of my juniors, she had made this picture. She had sketched herself. So what is this? What is this syndrome? Is this Soto syndrome, Beckwith-Weidman syndrome, infant of diabetic mother, or congenital hypothyroidism? What do you think, anyone? क्या लग रहा है ये? What do you think? Pancake, Rachna? Did you read about ATD angle? ATD angle, we do it in Down syndrome. Like this is the A, T, and D. This like this three angle we do it. No, it's a long explanation actually. Exactly. Who said D? No, this is Soto syndrome. This is Soto syndrome. The points are again very importantly macrocephaly, flushed cheeks, macrocephaly, flushed cheeks, pointed chin. Yes or no? You remember pointed chin? So macrocephaly, flushed cheeks, and pointed chin, important points of Soto syndrome. And it's one of the LGA babies. LGA babies with natal teeth. A baby having a newborn baby having teeth, and it's a big baby, large baby, heavy baby, big baby. That you should know. Yeah. Yeah, yeah, definitely she has done a very beautiful drawing, no doubt about it. Okay, and okay, next question. What is this, anyone? Which picture? Exactly. Yeah, Vivek is right. Premature eruption of teeth, pointed chin, flushed cheeks. Very good. What is this picture? Anyone? What is picture you call it? The options are, this is the picture you saw. The options are, I would like to thank Dr. Nitin for one of my very good juniors. Dr. Nitin, he showed me the picture. In his OPD it had come. The options are Pfeiffer syndrome, progeria, Cruzen syndrome, and Turner syndrome. So what do you think? Yes, very good, very good. So Pancake is right, Hemal is right, Steffi is right. Very good. Progeria. It's a case of progeria. Like a delayed, this is the typical case of progeria. Very important picture, and it's a case of progeria. Remember this one, progeria. Okay, very good. Pa movie, very good. कौन बोला ये? Hemal बोला. Very true. Okay, next question. It's a big one. Okay, yeah. Fine. The question is the most common location, for supernumerary teeth. Two more questions, then this class is over. Which is the most common location for supernumerary teeth? Supernumerary. The options are, these are the options: incisor, canines, premolar, and molar. Anyone? Yes. So, what is the most common location for supernumerary teeth? Yes, Pancake says it's basically a progeroid syndrome. Okay, and which is the most common location? So Basan says canines. So please remember. So this one, the photo itself telling you. Anyone? Yeah, very good. Rachna is right. Pooja is not right. And yeah, exactly. So remember, incisor, the most common location for supernumerary teeth is nothing but incisor. Okay, incisor is the most common location. What are the causes of supernumerary teeth? Savan, what are the causes of supernumerary teeth? एक बच्चे के बहुत सारे दांत हैं. Which is the most commonest cause you can think of? Anyone? What are the roughly causes? So the mnemonic was 3C and guard. Yes or no? So cleft lip, cleft palate, cleidocranial dysostosis, and Gardner syndrome. Gardner syndrome. Cleft lip, cleft palate, cleidocranial dysostosis, and Gardner syndrome are the important causes of what supernumerary teeth. Okay, remember we have done this in the previous classes multiple thousand times. We have done. That's why I'm having a speed. If you're a newcomer, please watch our previous videos. I always say that. Yeah, this is a good question. Let's see. Okay, you have to answer this. Read the question by yourself and answer me. True about dentition are all except. Very good, Savan. So 2 more minutes, then this class is over. We have already covered the whole good part. So what do you think? Question number 82. What do you think? इतने MCQs कर लो, मैं कह रहा हूँ इतने MCQs कर लो कि MCQs तुमसे डरने लग जाए यार भाई MCQ ना पूछो, इनको तो सारा आता है. ओके. Okay. True about dentition are all except. Hypothyroidism can cause delayed dentition. That's very true. It can cause delayed dentition. Premolar is not seen in primary dentition. Yeah, that's true. जो दूध के दांत आते हैं, जो 20 दूध के दांत आते हैं, that 20 teeth which are primary temporary teeth, premolar is not a part of it. That's very true. Third molar is the last appear in secondary dentition. Yes, third molar is the last teeth to appear in permanent teeth. And canine is the first in the primary dentition. No, in the primary dentition it is the lower central incisor which is the first teeth. So yes, D is the best answer. D is the best answer. Very good, very good. Okay, next question. Yeah, this is a good question. देखते हैं अभी कितना किसको आता है. Upper segment, lower segment ratio is decreased in what? It's a good question. Exactly. So Pancake, what could you tell us? How do you, Pancake remembers everything. So how do you differentiate renal edema from the cardiac edema? Anyone? कैसा आता है renal edema? और cardiac edema कैसा होता है? I think we all know that renal edema, basically if the edema is there of the renal origin, it will start from top to bottom, like periorbital swelling, facial puffiness, raised JVP, and like full anasarca, top to bottom. Whereas cardiac edema will be there in the dependent parts of the body, in the gravity part of the bodies, like lower limb swelling, like buttock swelling if I'm lying down. So renal edema will be top to bottom. Yes, exactly. Very good. Pancake is right. Renal edema is from top to bottom. Renal edema, edema because of nephrotic syndrome, edema because of kidney problems, will be starting from cephal to caudal. Periorbital swelling, facial puffiness, raised JVP, tender hepatomegaly, ascites, effusion, orchitis, or edema, pedal edema. Whereas cardiac edema started with the gravity, with the gravity, with the dependent parts of the body, and cardiac edema starts with the swelling of the feet. Yes, yeah, exactly. Yes, and what about, yeah? So so anyone yeah. So upper segment lower segment ratio is decreased in congenital in okay, decreased, yeah. So anyone, what is the answer? Yes. So congenital hypothyroidism, achondroplasia, and rickets, upper segment is to lower segment increases, but it decreases in spondyloepiphyseal dysplasias. Spondyloepiphyseal dysplasias में US-LS ratio कम होती है. हाँ जी. So Pancake, could you tell us about the Waters view and the Peirce view? Anyone? What about the Waters view and we also had the what you call Pierce view. Okay. In renal, why it starts? No, I don't know, bro. Because they said the loose as areolar tissue. Like I was watching the other lectures on Nelson. In the Nelson, I was reading like this skin or this one is a very loose areolar tissue. That's why it starts from this one. And as compared to the feet, the loose areolar tissue are the first things to to get edematous in a case of renal origin. That's what they mentioned, but nothing more than that. So yes, very importantly. Okay, so okay, anyone? So Pancake will tell us, Pancake, what is Waters' view? Say like for the paranasal sinuses, that one, right? So Waters' view and Pierce' view, how do you differentiate? In the meantime, let's do some other this one. Okay, last question, then this class is over. Question kya hai? Okay, the question is choose the correct option. The question is choose the correct option. In the meantime, people can answer choose the correct option. So what is the correct option in this one? Let's see if you can answer. Exactly, right. Yeah, very good, very good. So Waters' view and Pierce' view is the same. The only difference is in Waters' view, the mouth is closed. In the Waters' view, the mouth is closed, whereas in Pierce' view, the mouth is open. So yes, in the Pierce' view, most importantly, the mouth is open. How will I remember it? Because in Pierce तुम पानी पीते हो. Once you P for Pierce, P for पीना. पानी पीने के लिए मुंह खुला होना चाहिए. In Pierce' view, the mouth is open, and Waters it is closed. Yes, very true. So let's see. Question is choose the correct option. Achondroplasia with short trunk dwarfism. No, that's false. It is short limb dwarfism, not short trunk. Achondroplasia with short limb dwarfism with decreased USLS ratio. No, no, that's wrong. Option number B is also wrong. It is achondroplasia. It is short limb dwarfism with increased upper segment lower segment ratio. Okay, so C is also wrong because they told trunk. And achondroplasia with short limb dwarfism with increased upper segment lower segment ratio with champagne glass pelvis. Yes, D. Yes, very good. D is the best answer. So Hemal, remember dear, okay, C is not the best answer. It is achondroplasia with short trunk dwarfism. It is not short trunk. It is short limb. Exactly. Yes. This Lannister always pays his debt. Yeah, that's true. That's true. That's very nice. Okay, this is very nice. What is this? Okay, 1 second. Let me just check. Spotter. This is the spotter. Okay, this is a spotter. Let's see if you can answer. Hydrocephalus is a very common complication of this spotter. Option number 2, child will have prominent temporal bones. And option 3, it is also known as Klepp-Thissum syndrome. And A plus B plus C is correct. What do you think is the best answer? Okay, Waters' view is for the maxillary sinus, and Pierce' view is because is for this viewing the sphenoid sinus. So we have Waters' view, and we have the Pierce view. In Pierce view, the mouth will be open, right? In Waters' view, the mouth will be closed. And in what you call Waters' view, basically is for the maxillary. How will I remember? W का उल्टा क्या होता है? M. Okay, so Waters' view is because of the is to view the maxillary sinus basically, and Pierce' view is to view the sphenoid sinus, to view the sphenoid sinuses. Am I right? Am I right, Pancake? Yes or no? Thank you, Pancake, for telling us out. Yes, this is nothing but option number D is the best answer. This is nothing but our this Klebblatt-Shadel syndrome. It's hydrocephalus can be seen, and the child will have very prominent bones. And yes, that's the right answer. Okay, very good. Next question. Okay, what is the age of the baby? When can a baby open the drawers of Elmira? Anyone? Forget the options. When can a baby open the drawers of the Elmira? Yes, yes, very true, very true. Pierce view has S, so sphenoid sinus, and Waters view W का उल्टा होता है M, तो Waters view is to view the sphenoids, वो maxillary sinus. Yeah, a baby can open the drawers of the Elmira by 18 months. A baby can open the drawers of Elmira by 18 months. Okay, when can a baby, what is the question? When can a baby identify 1 to 2 colors? When can a baby when can a baby identify 1 to 2 colors? Anyone? When can a baby identify 1 to 2 colors? Any random guesses? When can a baby identify 1 to 2 colors? Options are 3 years, 4 years, 5 years, 6 years. This is a good question actually. Huh? Yes, very true, pancake. Very true. So, Waters view may you do the Waters view for to look for the maxillary sinus, and again the neonatal seizure with the worst prognosis is the myoclonic. Myoclonic. Thank you, pancake. Thank you for helping us out. Very thoughtful and very nice. I will update in my notes also while teaching neonatal seizure that the worst prognosis is myoclonic, and Waters view is done to view the maxillary sinus. I think I'll never forget that. So remember the mnemonic for this is 1 2 3 4 5. 1 2 3 4 5 is the mnemonic for this one. What you called 1 2 3 4 5 is the mnemonic. Means what? A baby can identify 1 to 2 colors by 3 years and 4 colors by 5 years. This is a very simple mnemonic. A baby can identify 1 to 2 colors by 3 years and 4 colors by 5 years. And here I was asking, when can a baby identify 1 to 2 colors? The answer is 3 years. Okay, very good, pancake. Raman, Basant, Savan, Pooja, very good. Yeah, this is a good question. What is the age of the baby? Forget the options. और option तो तुमको दिखाने ही नहीं, मैंने जो मर्जी कर लो तुम. हाँ जी. What is the what you called age of the baby? Who will tell me? क्या कर रहा है बच्चा ये सावन की फोटो बना रहा है? क्या कर रहा है बच्चा? What is this baby doing? What do you think? So what is this? Anyone? 18. Yeah, exactly. Very good. Very good. So a baby can draw a straight line. A baby can draw a straight line by 2 years. Yes or no? Because a straight line has two ends. A baby can draw a straight line. But this one is a vertical line. This is, see, there are two kind of lines. One is vertical line, one is horizontal line. So पहले बच्चा सीधा ऐसे करता है, पहले बच्चा vertical line बनाता है. So vertical line a baby makes by 18 months. A baby makes vertical line by 18 months. A baby makes straight line by 2 years. याद रहेगा. वर्टिकल हॉरिजॉन्टल लाइन बच्चा 2 साल पे बनाता है और वर्टिकल लाइन बच्चा 18 महीने पे बनाता है. 18 months. 18 months. Okay, done. Next question. That's nice. Oh, that's good. It's a good one. I am a child who can get alert by sound. I am a child who can get alert by sounds. I can also do cooing, but I cannot laugh out loud. Yeah, this is a good question. It's a very good question. What's my age? I am a child who can get alert by sounds, and I can also do cooing, but I cannot laugh out loud. I cannot laugh out loud. Anyone? Anyone? You sure it's 2 months? When can a baby laugh out loud? Question number 75. Question number 75. Question number 75. Question number 75. Yes, I was thinking the same. A baby can laugh out loud by 4 months. Okay. A baby can laugh out loud by 4 months. A baby can do cooing by 3 months. Okay. Yes. So social smile comes by 2 months. Social smile comes by 2 months. Recognizes mother by 3 months. Cooing by 3 months, and laugh out loud by 4 months. Okay, social smile. Social smiles means smile when talked to. Come, baby, come. So come. Social smile comes by 2 months. Recognizes mother by 3 months. Cooing again by cooing means like mwah, mwah, like cooing by 3 months, and laugh out loud. Laugh out loud by 4 months. Laugh out loud by 4 months. I think that's enough. That's enough. I guess बहुत सारे हो गए question. That finishes today's session. Thank you so much everyone for this wonderful participation. काफ़ी हो गए, बहुत सारे questions कर लिए हमने. I think बहुत 90 पे था, ये 75 में 25 questions यहाँ कर लिए, neurology questions कर लिए. So I think we are on a good speed. We are on a good speed of covering pediatrics and revising pediatrics to the maximum extent. And thank you so much everyone for this wonderful participation. Tomorrow we again have a class at 5:15 p.m. and the second class again we have 8:30 p.m. So 5:15 p.m. and 8:30 p.m. again we have two classes. Either it will be there on the YouTube channel or it will be there on the Unacademy app. Download Unacademy app. Write Anand Bhatia over there. ANANDBHATIA Anand Bhatia follow me there, and if the class, you will get the notification whether the class is on the app or on the YouTube channel. But definitely we will, what you call, have two sessions tomorrow, 5:15 p.m. and 8:30 p.m. Okay, do more questions? Yes dear, for sure. Let me just take one or two lectures, again I will put questions. We have huge amount of questions, like huge amount of questions, so it'll be nice if we participate. That's what. Thank you everyone, take care. आज इतना ही होगा, एंड कल करते हैं, ठीक है? अपना ख्याल रखो एवरीवन, टेक केयर, बाय बाय, थैंक यू, गुड नाइट।